So my name is Claus Yding Andersen. I'm from University of Copenhagen, where I'm professor in human reproductive physiology, and I'm also now affiliated the Well Women's Center at Sir H.N. Reliance Foundation Hospital here in Mumbai.
And my name is Linn Salto Mamsen. I'm a PhD and a senior researcher at the Laboratory of Reproductive Biology in University Hospital of Copenhagen, and I'm also affiliated to the Well Women's Center at Sir H.N. Reliance Foundation Hospital here in Mumbai.
So, Linn, in the context of this new technique that we are now trying to work with here in Mumbai, I think that the women's fertility is an important parameter, and I think it would be interesting to sort of put into context how the fertility of women, and for that matter boys, are actually developing, and why this new technique is different from boys and girls.
Yeah, it's a very important question you raise here, because the reproductive system in males and females are very different, and as males they can produce semen from puberty and throughout life. Then that is a big difference to women, where we are born with a finite number of oocytes, and they are the capacity that we have to sustain our fertility from reproductive age and during the reproductive years. And when we face gonadotoxic treatment, then we would diminish the pool of follicles, and then our chances of becoming pregnant are reduced. And because we cannot produce more oocytes than we are born with, and we have during childhood an accelerated follicle loss that is absolutely normal, and that accelerated loss would increase with age. So that is also why, as women, we experience to go into menopause around the age of 50 years, and after the age of 40 we should not count on becoming pregnant. So if we are facing gonadotoxic treatment or having other diseases that have a negative impact on our ovarian reserve, we are at risk that we will not get the children we wish to have. And that is why the fertility preservation is coming in as a very important treatment, particularly for women. And also, of course, it's important to notice that for prepubertal, both boys and girls, then cryopreservation of tissue is the only available option for fertility preservation. Just please tell me, how are we actually doing the cryopreservation techniques? What are we doing when we get the tissue?
So there is an anatomical characteristic of human ovaries that actually facilitate the fact that we can now cryopreserve ovarian tissue and sort it out, transplant it, and it'll start to work again. And this is basically because, as Dr. Mamsen explained to you, that the ovarian reserve, the follicles that needs to provide fertility throughout life, is actually situated in a very defined area of the human ovary. It's actually specifically located in the cortex. 1 millimeter from the surface, all the resting follicles are located. This means that more than 90% of all follicles in a human ovary at any moment in time for any woman will be positioned in the cortex. So what we do when we cryopreserve the tissue is that we isolate the outer 1 millimeter of the ovary. And this now contains all the resting follicles, which are so small that they do sustain freezing. So we can make cryoprotectants penetrate these 1 millimeter so fast that we don't experience toxic effects, and then we can cool them off to liquid nitrogen and keep them there for as long as we basically want. We have had tissue stored now for more than 20 years, and when we sort it out, it works perfectly. So this is now then an opportunity for the follicle to survive. So when we transplant it and the woman is menopausal, she will have supraphysiological high levels of FSH, which will then start to stimulate these new follicles, the resting follicles, and then within 4, 5, 6 months, we have an organ function coming back. Now we have preovulatory follicles, and one preovulatory follicle per cycle is basically the ovarian function. So this is the reason why we are able to do this so nicely.
We transplant all the tissue at once, or can we do it in different ways when we want to get back the tissue?
So what we do is we prepare the cortex, but not as one piece, but as a number of different pieces of cortex. So often a woman would have 20, 25 pieces of cortex, which we now cryopreserve in individual ampules. So the woman would have 25 ampules with her tissue, which means that when she comes back for transplantation, we can decide how many pieces of tissue we're going to transplant. If the woman was relatively old, say in her 30s, then the ovarian reserve is already going to decline. Then we may decide that we will put back more tissue, or if she is very young, so if she is 15, we may just don't want to put back too much tissue. She would still have a lot of follicles, so she do regain her fertility. So this depends, and we have young women in Denmark who are coming and saying, oh, I'm 28, I have no partner, don't have a pregnancy wish at the moment, but I just don't want to be menopausal, so could you put back just a few pieces of my tissue, which will then provide her with follicles which will maintain her menstrual cycles. Obviously, this is also now, as Dr. Mamsen explained to you, the only option for prepubertal girls, because you cannot stimulate them, you cannot do anything else. So if you do want to save their fertility, it is cryopreservation of ovarian tissue. Often I have had the question of whether, do you know whether this tissue actually works? Because it didn't work when you took it out. But we have now, we have had to wait for these girls to become old enough to have a wish to have their tissue back. But we have now done it in several instances in Denmark, and the tissue do start to work. It do provide fertility, and a number of women have now actually had babies born from this tissue. So this is very reassuring, I think. So, Dr. Mamsen, could you please explain to me, so how do you see this new technique overall? Where are we at the moment, and where do you think we will be going?
I think we are at the moment that this technique is getting ground, and we do see that the technique works. There are actually babies born from this technique, and that is also why this technique is spreading all over the world. We have worldwide more than 20,000 women has ovarian tissue cryopreserved, and I believe that more than 1,000 women has also got the tissue transplanted. And worldwide this has resulted in more than 200 healthy babies born after this technique. So that just illustrates that this tissue is being implemented all over the world, because it actually do work and have a huge options for future fertility, both for women and as the only option for children.